See us and hear us? I think that's a yes. All right, I see thumbs up. Perfect. Okay, thanks everyone for joining. There's 75 of you here. That's pretty amazing. Thank you for giving us your time tonight. All right, we're gonna jump in with some questions that you guys have been asking. Keep the questions coming. We'll start with the first question. Can Sofwave be used on all skin types?
Yes.
Yeah, so that's kind of the best thing about the technology is that it's colorblind. It basically bypasses the very tippy top layer of the skin, and the heat gets put in the deep collagen layer of the skin, which is why you can treat all skin types, but it's also why there's virtually no downtime. So yep, anyone can be treated.
And safe for all ages and genders.
Yep. Okay, how many treatments are needed for best results? Let's see how each of us answer this question. Angie, go for it.
Well, for my patients, it's going to depend on their age, treatments that they've done in the past, and if they also get injectable fillers. So I would say for most patients, they do one treatment, wait about 6 months and see how it goes, and then they can choose to repeat the treatment and then keeping it up annually.
I would agree with that. Some patients that are older that have never done any sort of collagen boosting treatments, I might recommend that they do a second treatment at the 3-month mark and then repeat yearly moving forward, depending on their result.
Yeah, I completely agree. That's exactly how I do it too. Okay. Someone asked, how long has this protocol been on the market? So we've had Sofwave in the office for a little over 2 years now. The product has been on the market since just about before 2020, so right before COVID that it launched. So it's about going on 5 years now. And there's been thousands upon thousands of this procedure performed. And the ultrasound technology it's based on has been on the market for about 10 or 15 years. So it's certainly not something new. Okay. Someone's asking about pain management. Okay, so let's talk about the different options we have. So who wants to take this one?
I will. Normally we recommend doing 30 minutes of a topical numbing cream, and we have different strengths for different skin types and needs. And then some people who want extra pain control can opt to have Pronox, which is a nitrous oxide gas that is in and out of your system in about 10 minutes so you can drive. We don't offer any sort of oral pain medications because it's really not necessary with this procedure. That's what makes it so likable for most people.
Yeah. So unlike some of the other stuff that we've done for skin tightening where you need to take oral meds, you don't really need to do that with Sofwave. We also do have the option of cold air that you can use throughout the procedure. So it kind of allows you to participate in your care, but also allows you to kind of get the cooling where in the area that you need it. And the vast majority of patients do fine just with that. Okay. What's the difference between Sofwave and Ulthera?
Okay, I'll take
Yeah,
this
go
one.
for it.
So Ulthera has a few different depths. So it goes about 4.5 millimeters, 3 millimeters, and 1.5 millimeters. So there's a few different passes, and Sofwave actually just goes 1.5 millimeters. So you're going to get more of that kind of top layer skin tightening with Sofwave. So it's best for patients who have kind of that crepier skin close to the surface.
And then to add to that, so like, someone will think, well, why don't I just do Ultherapy because it gets the top layer and the deep layer? It's a matter of also the percent you cover. So with Ultherapy, you're covering about, 15, 20% of the skin in all 3 of the layers, where in Sofwave, you're covering about 50 to 75% of the top layer. So I think that both technologies are meaningful and have places and to be used. And we do have some people who kind of go back and forth between them, but the key difference is the depth and the density. And then someone asked about how expensive is it? How does it compare to Ultherapy in price? Same price. So that's designed on purpose because we don't want price to be an issue when you guys decide on which one to do. Someone asked about doing upper arms. So we'll let Dr. Fincher answer.
Yes, you can do upper arms, and we have a new body hand piece that makes it even more effective for using it on the upper arms and other body parts as well, abdomen and legs as well.
Yeah, so abdomen, legs, upper arms, knees, thighs, and now with the larger handpiece, we can move at twice the speed, which is nice. Someone asked, how does it work to stimulate collagen and does it hurt? Well, I always joke that the laser that doesn't hurt is the laser that doesn't work. So of course you have to pay the piper and there has to be some sort of discomfort. But the way it works to stimulate collagen, all of these collagen stimulators do the same thing. They use a controlled stimulus to controlled injury to cause heat the collagen that you already have. causes microinjury to the collagen, and it starts a biological process that gets your body to build new collagen. So just like when you go to the gym and you lift weights and you get tear in the muscle fiber and you get bigger, stronger muscles, the same thing happens to your collagen. So that's basically the mechanism of how this works. What is the difference between this and Halo treatment in the long run? This is just a matter of what plane you're treating in. So the Halo treats a very, very superficial layer of the skin, where you want to think about where the Halo does is more for pigmentation, texture, and pore size and fine lines. The Sofwave is more for lifting and tightening. So it's just a deeper technology. They're both complementary to each other. There's no reason why you can't do both. Someone said you're also lovely. Thank you. That's very kind.
Thank you.
Okay, someone asked, there's been a couple of questions about Ellacor for the neck and lower face and how does it compare to Sofwave. The Sofwave, you want to think about heating and lifting and tightening. The Ellacor really is for people with true like loose skin, the kind of skin that you feel like it's crepey here or crepey here, because the Ellacor is the only technology we have that removes actual tissue. So they're not necessarily analogous to each other. You may be a better candidate for one than the other. You may actually be a candidate for both. And we do have patients who've done both because they do serve certain different needs. So to kind of get a better sense of what the right choice is for you, it's probably best to schedule a consultation. Okay, someone asked, we get asked this question all the time. I'm very concerned about fat loss in the face. Can you speak to the impact of Sofwave on facial fat? All right, let's let everyone weigh in on this because I'm sure we all get asked this every single day. Okay.
Well, I'm going to steal from Dr. Jolly.
Oh, come on.
And I'm going to say, if we had a laser that could melt fat, we would be using it to melt fat. And so I believe that, you know, the way that the Sofwave heats the tissue, it's not at the right plane or the right temperature for the proper amount of time to actually heat the fat and melt fat.
Nor does it melt fillers in the same way.
Yeah, I always tell people, you know, the analogy about planes, right? Like, do planes crash? Absolutely. Do they happen all the time? Never, right? So to say that these technologies melt fat is like saying every single plane crashes, right? There are very, very, very rare side effects that do not happen. And if it happened consistently, we'd have a line around the block making 6-packs for everybody, right? So I think it's a very, very rare complication, and particularly with Sofwave, you know, it only really hits 1.5 to 2 millimeters in the skin, so it's sitting above the fat plane, so it's even less likely with this technology. I'm not aware of any reports in the literature that it's that this has happened. We've certainly not seen it in our patients, so you know, I think it's the least likely to do it of all the technologies.
And then how do the results compare to microneedling and Fraxels and other collagen enhancing procedures? Well, the Sofwave works differently than Fraxel and microneedling because those procedures, again, they're similarly to the Halo that we discussed, treat the top layers of the skin. Fraxel and Sofwave and these modalities are complementary to one another because the Sofwave treats below where the Fraxel. So they're different, and again, a consultation would be beneficial to discuss what treatment to use along with Sofwave if needed.
Okay. Someone said, how frequently does the treatment need to be repeated to maintain results? I think we kind of touched on this. Angie, you want to reiterate that?
Yeah, so we were saying initially you might want to do one treatment, wait, you know, 3 months, 3 to 6 months, and do a repeat treatment. And then patients will do it annually or twice a year to maintain results.
Okay, this is a good question. How can I choose between Sofwave, Thermage, and Ultherapy? Dr. Fincher.
Oh, no.
Well, we can all kind of weigh in on this.
Yes, I'll weigh in on it.
Okay.
We've been doing all three for so long now, and the Thermage is a really unique device because unlike the Sofwave, you can treat eyelid skin with it. So it has a niche in that way. Thermage is also a bulk heating device, and we get great results with it. So I think it just depends on what energy source you want to use. Thermage is radio frequency, and Ulthera and Sofwave are ultrasound. So they're slightly different in that way. They're both fabulous, but they do work differently. And again, a consultation would be best to determine which of those modalities we would use for you.
Angie?
Yeah, I agree. I think, and a lot of patients can and will do both or all three, depending on what they want to address. But for me, I've seen with Ultherapy, you know, if you have really good skin quality, but maybe heavy jowling, then maybe Ultherapy would be a better option for you. If you don't have jowling, but you have a lot of sun damage or a lot of fine lines and crepey skin, then Sofwave and Thermage might be a better option.
Yeah, I completely agree. I think Thermage shines around the eyelids, and that's honestly the only technology that can be done around the eyes with no downtime that has a biological effect. So that's where that device shines. And then I like Ultherapy for, like Angie said, really heavy tissue, particularly people who have heavy, double chins and things like that. I think that does a really nice job there. And, there's no reason why, we've done it before, like we can piece together a treatment protocol that's optimized for your particular needs. Like I've done Ultherapy on just the area and then Sofwave everything else. And we can certainly do that depending on everyone's particular needs.
There's a good question. If one wants to do a second treatment, is there an amount of time that is too long to do it? Absolutely not.
Yeah. It just depends on whether you're going to do 2 back-to-back or, 2 a year or so apart. But think about it like saving for your 401k, slow and steady wins the race with these sort of things. Someone asked, how long should you wait after you get fillers to do this treatment?
We can do it the same day.
Yeah. Typically, if you're wanting to do fillers, it's a common practice for us to do Sofwave and then fillers immediately afterwards, particularly if you're doing a biostimulatory filler, because they dovetail into each other and work together. If you have pre-existing fillers, probably best to let that settle for 2 to 4 weeks, but then you can do Sofwave and it's not going to affect the filler that's been placed.
Somebody asked about platysmal bands.
Yeah.
So platysma bands are a common thing that we treat also with Sofwave, but we use neurotoxin as well. So you get a really nice result if you have platysmal bands to do kind of a combination of a neurotoxin and a device, and that gives you a better outcome for those.
And platysmal bands are the little bands under the neck.
These.
Oh, 2 little, yeah, for those of people that don't know. Look.
Yeah. Do you have to do the whole face, or can we do just neck alone, or neck and lower face and neck? There's all sorts of different combinations available. The office can give you kind of pricing, but no, you don't have to do everything. Of course, we're firm believers that everything is connected to each other. So I kind of joke sometimes that why would you remodel your kitchen and leave the bathroom the same? So you just think, but if for whatever reason there's a particular part of the body that's bothering you and you want to really work on your neck, we can certainly do that.
Yeah, we like to customize treatments for patients that have specific needs.
Someone asked a good question. We kind of already touched on optimal cadence for frequency, but they also asked, is there anything we can do to optimize or increase results? And then finally, is there a point at which it stops working?
Is there
That's
a point
good
at which it
question.
stops working? I mean, I guess, it's not going to be a surgical result. So if that's what you're, looking for, then, it's just not the same. So I guess there is sort of a point at which you would maybe kind of plateau, like it's a bell curve.
Yeah. Yeah, I agree. I mean, it's like at some point, like everything we do as we unfortunately age becomes diminishing returns. So you are going to hit a point where you're going to see less and less. However, I will say, and I think we've all been doing this now for 10 plus years, the people who do this regularly look better than the people who don't.
Yeah.
So it definitely really slows down the aging process. And you may not realize why you're doing it, but once you stop, you realize why you did it. Okay, we've already answered some of these questions. This is a good one. Why do all cosmetic surgeons on social media hate Sofwave so much? They talk about damage it does to the tissue. Are they making that up?
Okay.
Well,
This is a tough
yeah, this is a tough
Yeah,
one.
I was just saying, so what our surgery colleagues have told us is that, if you do it too close to the surgery, maybe, you're creating the tissue, it's a little harder to excise. So, if you're going to get a facelift in a couple of months, probably not a good idea to do it, but then you can talk to your surgeon, certainly. But others have said it, fine to do, and they don't see problems.
Right.
So,
And one would contend too that because the collagen is thicker and tighter, it's harder to get that plane to lift the skin up. It makes it a little harder for them, which is possible, but there are also cosmetic surgeons that do Sofwave, Thermage and Ultherapy as well, and they don't find that to be a problem for them.
and think about what the surgeon wants to do is they want to do surgery, right? So not that this is, none of the surgeons are quivering in their boots about these procedures because they're not anywhere equivalent to surgery. But we've had countless patients who've had many of these procedures, Ultherapy, Thermage, Sofwave, who've gone on to have great facelifts down the road. So it does not preclude you from having a facelift by any means down the road. Someone asked, how is it different than Ultherapy? Mostly that's an issue of depth and density. They can be complementary in certain cases, and you should schedule a consultation so we can figure out what best suits you. Answer some of these questions.
Oh, this is a good one. Does regulating sun exposure offer a longer period of benefits after the Sofwave? I mean, as dermatologists, we always advocate for sun precautions, but in this case, you can do it in the middle of the summer after a vacation in Mexico. There's no risk in causing any harm. And we have not seen any sort of pigmentary changes with the device because it does not treat that part of the skin whatsoever.
Okay, someone asked, does it help upper lip lines? There was a study that was done that showed that it helped upper lip lines some. I think, if it helps your upper lip lines, it's an added bonus, but I would not choose this technology for lip lines. You guys?
Which are very difficult
Yeah,
to treat.
they are.
Yes.
There's other things we have available in the office that may be more suited, that would be better bang for your buck for sure. Can it be done for the upper and lower eyelid? No, it can't. But if you do, we do treat the brow regularly, and of course, if you get a brow lift, your upper eyelid looks better. So in a way, it does affect the upper eyelid, but we can't treat the eyelid itself. If you're interested in treatments for your upper and lower lid, we recommend Thermage. This is a good question. What's the results when using it on the body? How many treatments do you need to target these areas?
I think so far, the patients that I've treated with the body, it's at least 2 treatments, I would say, especially for abdomen, like postpartum or knees. And then, with maintenance, we're still kind of seeing, how often they need to do it, but it's probably once a year. And it can be combined with other treatments and devices we have as well.
Yeah, nothing works as well on the face and the neck as it does on the body. So I think with body, you have to have really tempered expectations because it doesn't always stimulate collagen the same way that face and the neck does.
I think that's good.
Yes.
Are there dietary restrictions or recommendations? I love this question because there are none. There's no restrictions whatsoever. And the best part about it is you can work out and do everything that you want to do right afterwards too. Eat, drink, have a party, whatever. Go to yoga, stand on your head.
Yeah.
It's totally safe to do. And a lot of things aren't like that. And there's no pre-treatment. You come in, you do the treatment, and you resume full activity. You just have to wait a couple months to see the results. And I think the delayed gratification of this is one of the things that people have to realize.
Okay, great question. Can you combine Sofwave with Sculptra?
Yes, definitely can. And at our practice with Dr. Fitzgerald, doing tons of Sculptra, you get kind of a synergistic result oftentimes because the Sculptra is building collagen, the Sofwave is building collagen. Sometimes she will do it same day. So you do the Sofwave first and then the Sculptra. And it's a really, really nice result.
Someone asked just a logistical question about how consultations work at our office. There will be a text link available at the end that can help you set this up. So stay tuned for that. Can you do Sofwave and Fraxel during the same treatment, one after the other?
Yes.
Yeah.
And we love to do that.
Yeah.
It's a good way to get all layers of the skin treated at the same time. Great result.
Yeah, you'll treat the superficial layer for the pigment texture and pore size, then you'll treat the deep layer for the lift. It's a nice 1-2 punch. Someone asked about before and after pics. That was in the video that was aired. I don't know if that'll be archived on our website, but you should have access to that. Someone asked about downtime. Virtually 0 downtime. You can go about all your normal business without any sort of issue. Someone asked about Botox and Sofwave same day.
Yeah, we do it all the time.
Yeah. Routine practice.
Yes.
Someone asked a very technical question about do we recommend TTE or treat with total pulses? I think we probably do a combination of both, depending on the targeted area. So the TTE, for those who aren't aware, is that they call treat to energy. So you're trying to get a certain amount of heat in this particular area. The nice thing about that protocol is if you find it unusually uncomfortable, you can turn it down. It's just a matter of getting the total energy. It just takes a little bit longer. And I think at least what I do is I do treat to energy in certain areas, and then I try to blanket everything with a certain number of pulses. Upper age limit of any of this to be effective. Is there an ideal age?
No, I've treated several people in their late 70s and even 80s, and they've been very satisfied with the result. It's been really fabulous in that way.
Same, agree. I've had people in their 70s be very happy. Someone asked a good question. Does taking collagen supplements help with this in any way?
I guess I can answer.
Yeah,
We don't know.
exactly.
We don't know if collagen does anything in general. So yeah, I guess we don't know. Yeah.
I've had the Sofwave, 4 times? 5 times?
I've had it 5 times, 3 or 4, at least 4 times, maybe 5. So yes. Yeah, so we have to practice what we preach. I think between the 3 of us, we've done everything in the office at least twice. So yeah, of course. So someone was a little bit late and asked, does it work on jowls? And the short answer is yes. If you only do Sofwave once a year, will that still slow down the aging process?
Absolutely.
Yeah. Someone asked, if you are in your 40s, doing once a year plus Fraxel microneedling, is that enough?
Depends
It's a
on
good
the
perk.
person
Yeah.
and, genetics, skin type, sun damage, but I would say yes.
Yeah, how we approach a patient depends on what their particular needs are and their particular tissue layers, right? So we age in all the different tissues. We age in bone, we age in fat, we age in muscle, and we age in our skin. And not everyone ages in all these layers the same way. And so one of the nice things about coming to an office like this is we kind of have all the tools to kind of optimize and make it look the most harmonious. Okay, I think we've run through all of our questions. Just to reiterate, there's going to be a link that's going to be sent out to you guys via text message that will allow you to kind of next steps to book a consultation. So that'll be posted. And we do have a special promo. So for those of you who are familiar with our practice, we do tend to have holiday specials every year. And one of the things we offer is $500 off Sofwave. And we are rolling this out early for those of you who have attended this webinar today. So you're going to receive a text immediately following the event, and text back LIFT, L-I-F-T, if you'd like to schedule a consult, and one of our patient care coordinators will reach out. Okay. All right. Thank you so much. Thank you so much. Have a good night. Bye-bye.